This lecture is over anxiety disorders and it's given by Hannah Lillard. So definition of anxiety disorders are actions and mood that anticipate danger or a threat. It is characterized by a negative mood state and physical tension and apprehension about the future. Anxiety does not go away and it worsens over time, interfering with a person's life. Some general biology affected is genetic vulnerability. So this means that it can or cannot be in your genes and it is common among some family members. Specific to certain neurotransmitters, this can be depleted levels GABA or corticotrophin releasing factor, CRF system. This impacts areas of the brain associated with anxiety. And the areas of the brain that are associated with anxiety are the brain stem, amygdala, hypothalamus, and the prefrontal cortex. So under the DSM-5, there are tons of categories of anxiety disorders. Some of them include, or all of them are separation anxiety disorder, selective mutism, specific phobia, social anxiety disorder, otherwise known as social phobia, panic disorder, panic attack specifier, agoraphobia, generalized anxiety disorder, substance medication-induced anxiety disorder due to another medical condition, and other specified anxiety disorders, and also unspecified anxiety disorders. The ones that we'll cover in this lecture will be generalized anxiety disorder, or GAD, panic disorder, social phobia or social anxiety disorder, agoraphobia, and specific phobia. Generalized anxiety disorder, GAD. For this to be a true diagnosis, it has to happen for at least 6 months, and it is a constant worry and anxiety across multiple areas or domains that lasts more days than not. Also, for this to be a diagnosis, it has to have at least 3 of these symptoms: restlessness or feeling on edge, muscle tension, sleep disturbance, easily fatigued, irritability, difficulty concentrating, or mind going blank. With generalized anxiety disorder, worry is the feature of this disorder. And it's very difficult to control. There's huge impairment in the patient's life and one of the more common comorbid conditions. So with this disorder, it's just right in the name, generalized anxiety disorder. It's just very general and broad across multiple subjects. The next disorder, panic disorder. This is a recurrent, unexpected panic attacks that have the presence of at least 4 of the following symptoms. And these symptoms happen during the panic attack and what will specify it being an actual panic disorder or a panic attack. So it is palpitations, sweating, trembling or shaking, chills or heat sensation, numbness or tingling, derealization, shortness of breath or sensation of smothering, feelings of choking, chest pain or discomfort, nausea or abdominal pain, fear of losing control, fear of dying, and dizziness. Attacks are sudden and often happen very repeated for the panic disorder. The feelings of being out of control during the attack, it's also very persistent to concern about when the next attack will happen. So they're constantly worried that they will have another panic attack or when it will happen. They fear and or avoid the places where pre-attacks have occurred. And it's significant that there's a maladaptive change in behavior related to the attacks. So say the attacks always happen in a certain situation, they will, or a place, say every time they go to the grocery store, they have a panic disorder. They will not go to that grocery store, and it was extremely maladaptive at having to have someone else go get all of their trees every day. This, of course, is just an example. There's multiple examples. If, say, they have panic attacks in elevators and they have to go take the stairs everywhere, this is fine, but it can be very maladaptive if they live on the 20th story of a building. So it's just having to go completely out and change your behavior to accommodate these panic attacks. Social phobia is also known as social anxiety disorder, and this anxiety disorder is marked by a fear about one or more social situations in which the individual is exposed to possible judgment by others. They fear they will have a negative evaluation of their peers or just their other people in general. And they have social situations always prove fear or anxiety, always provoke fear or anxiety, and they are avoided or endured with intense anxiety. So just because someone will go through with a social situation, that doesn't mean that they necessarily do not have social phobia, because if they are enduring it with severe anxiety, then that would classify them as having social phobia. Some symptoms of this disorder include anxiety about being with other people, self-consciousness in front of other people, afraid others will judge them, worrying for days or weeks before an event, avoiding places where there are other peoples. They have a hard time making and keeping friends, which makes sense because if they don't never go out into social situations, and most people do that in friend groups, they will have a hard time maintaining that friendship if they already had it or making new friends. They also, a symptom is blushing, sweating, or trembling around other people. And also they can become nauseous or sick to their stomach when around other people. And all of this leads back to that phobia of having to be in this social situation, or even just being around people in general. Agoraphobia, this is the fear of being in situations in which getting help or escape may be difficult. So to be diagnosed with this, there has to be a marked fear of two or more of the following. There has to be fears or avoidance of situations because escape may be difficult, and the situation must almost always provoke anxiety. The situation actively is avoided, and there's really no real danger for them to have this fear, and so they are blowing it out of proportion. So sometimes having a fear of something that's life-threatening, that is completely normal, but if it's not life-threatening, there's no real danger, but they're having the fear, then that would count as that. And it typically persists 6 months or more to be marked as agoraphobia. Some situations where agoraphobia takes place, or what people are afraid of with this disorder, is using public transportation, being in open spaces like a huge open field, or being in closed spaces like extremely tight, compact. Even an elevator could feel like a too enclosed of a space. Being outside of the home alone period, so just leaving the house alone, or standing in a line or being in a crowd, can all make them very uncomfortable and give that anxiety of this disorder. And this disorder, then they will have the symptoms of the other anxiety-driven disorders like the sweating, palpitations, fast heartbeat, nervousness, nausea, sick to their stomach, all of the other ones that I just previously went over. The next phobia would be specific phobia, And this is a fear of a specific object or situation, and the object or situation almost always provokes fear and is actively avoided. And again, it is out of proportion to response to actual danger, and it's typically 6 months or more for it to be considered an actual diagnosis. It's clinically significant distress. So if you are actively avoiding something of your specific phobia, and again, if it changes or modifies to maladaptive behavior, then that is a huge problem and needs to be taken care of. And so specific phobia, some specify if here's just some examples of what kind of specific phobias there can be. So there can be an animal, such as spiders, insects, or dogs. Natural environments, such as heights, storms, water. Blood injection injury, such as needles. Situational, so these are the situation or the specific phobia, the specific fear is just situational and does not happen in the normal environment that often, like having to be in airplanes or elevators. And then there is the other miscellaneous category. So why exactly does this happen? So sometimes it can run in families, as I said earlier, with the genetic vulnerability, but it's not known why some members have it and while others don't have it. It's kind of related to addiction, into where, yes, we can see there is a strong genetic link, but just because someone has it in your family doesn't mean necessarily you will have it. And we don't understand why some people have it and some don't. And again, parts of the brain play a role in this, in these disorders. And the parts that do play a role are the brainstem, amygdala, hypothalamus, and the prefrontal cortex. In panic disorders, there's been research, and some researchers think that people with panic disorder misinterpret harmless bodily sensations as threats. This still needs to be tested, but it is a strong belief that this happens. And then for social phobia, some researchers think that misreading of others' behaviors may play a role in causing social phobia. So for example, you may think that people are staring or frowning at you when they're really not. And some researchers also think that weak social skills are another possible cause for social phobia. And so for this example, if you have weak social skills, you may feel discouraged after talking with people and may worry about doing it in the future again. So who's prone to get it? Really, it's completely across the board. People can get it just because if you don't fall in one categories, you could still get it. This is just people who are more prone to get it. Coincidentally, there's some health conditions that can imitate or worsen anxiety disorders. And so overactive thyroid or low blood sugar are two examples that can do this. And then genetic and environmental factors that play a role in anxiety disorders are shyness in childhood, females, few economic resources, divorced or widowed, stressful life situations, anxiety disorders in close biological relatives, parental history of mental disorders, and elevated levels of cortisol in the saliva during the afternoon. Treatments and therapies. It usually begins with a visit to the primary care provider, and this is just because the symptoms often include like raised, an elevated heart rate, sick stomach, sweating. So it's just very like common problems that you don't necessarily think there's something mentally wrong with you. You think there's something physically wrong with you. So you'll go to a primary care provider instead of a psychologist at first. So then another treatment for this, after you see your care provider, usually they give you to psychotherapist. And so a treatment for this is psychotherapy, which is, and they use cognitive behavioral therapy, or CBT. Another treatment is self-help or support groups, stress management techniques, and medication. And I will go into these 4 right now. So psychotherapy is also known as talk therapy, and it's directed at a person's specific anxieties. And so it's very specified to the person, and they use cognitive behavioral therapy, which is CBT, and it teaches the person different ways of thinking, behaving, and reacting to the anxiety-producing situation. And so there's 2 different parts of this. There's cognitive therapy and exposure therapy. And so cognitive therapy focuses on identifying, challenging, and neutralizing unhelpful thoughts underlying the disorder, while exposure therapy focuses on confronting the fears underlying the disorder. And that is coupled relaxation exercises to help you relax while you are in the proximity of this fear, or you are exposed to this fear that you have. And all of these in CBT is usually conducted individually, or it can be conducted with a group of people with similar problems. Self-help or support groups, they share the problems and achievements with others. You can use internet chat rooms, talk with a trusted friend, but those last 2 things I said are not alternative to care from an expert clinician. Stress management techniques are techniques and meditation to help calm themselves. Aerobic exercise has been shown to help anxiety disorders, but it's not proven yet. There still needs to be more research. Along with avoidance of caffeine, certain illicit drugs, and some over-the-counter cold medicines, which can just make anxiety disorders worse. And also having a very supportive family can help lower your anxiety disorder symptoms. Medication can also be used, but the medication is not a cure. It just relieves symptoms. Sometimes used initially, or it can be a response to when it's inefficient, when you get an insufficient response to psychotherapy. And then, so the medications that are commonly prescribed are antidepressants, anti-anxiety, and beta blockers. Antidepressants are more common to be given to people who have panic disorder or social phobia. Anti-anxiety is usually the first line of defense for generalized anxiety disorder, while beta blockers, they control rapid heartbeat, shaking, trembling, and blushing, so those are common to see throughout. So a quick review of what we've gone over with this lecture is that anxiety disorder is a negative mood state characterized by bodily symptoms of physical tension and by apprehension about the future. There is a huge, broad, multiple different categories of anxiety disorder, but the ones that we covered were generalized anxiety disorder, panic disorder, social phobia, agoraphobia, and specific phobia. The reasons that we talked about were some genetics, some biological about where the brain affects it, and environmental factors all play a role. Treatments that we went over were psychotherapy, specifically CBT, self-help and support groups, stress management techniques, and medication. Resources that were used to make this lecture. Thank you so much for your time, and I hope that you learned something a little bit more about anxiety disorders that you did not know before.